Welcome back. Yes, indeed, as you've seen there, Professor Muhammad Ali Pate joins us next. He is the Coordinating Minister of Health and Social Welfare. Good morning. Thank you for coming on today.
Good morning. Thanks for having me.
What is the social welfare component to health, though?
Well, health is at the core of the existence and well-being of any individual. So at the root of it, health is connected to whether an individual survives from childhood, makes the transition to adulthood, and lives a healthy life and a productive life. So the coordinating role that we have implies that we coordinate activities of government at the federal level, but we also interrelate with subnational actors as well as external parties and non-governmental actors to improve the overall health and well-being of Nigerian citizens.
So, but before now, who's been doing that? Which ministry, agency, or anything?
Well, President Bola Ahmed Tinubu's administration is a progressive one, and it focuses on the overall well-being of the Nigerian population. This is one of the innovations that the president, in his own wisdom, decided to add social welfare dimension to what the health sector traditionally has done. Health is not just about what happens in the hospitals or facilities. It goes beyond that. It's an all-encompassing effort that will produce health. And I think we have to really appreciate the insight, the vision that informed the president to really construct this health and social welfare as an entity, whereby we do what is needed in terms of healthcare, but also not losing sight to other determinants of health that are important to improve the overall well-being of our population, which is the most important asset that we have as a country.
So even if those other determinants of health are under another ministry, how does that work?
Well, there's one government, so it's a whole of government approach. The fact that we are cooperating, collaborating, respects the roles and the capabilities that are inherent in every sectoral ministry. But it's one government, it's one team. And working collaboratively, Ministry of Women's Affairs will deal with issues that are related to women but have implications for health. Ministry of Humanitarian Affairs has important role that it is doing and will need to do that and do that well, and we will support them to succeed in what they do.
For instance, Ministry of Water Resources.
Very important sector.
Very important.
Water and sanitation are important determinants of health. We would like the Ministry of Water Resources to succeed, just as they also, in a way, would want us to succeed, but we operate as a team. So it's not a traditional sort of siloed approach that we have. It's one that is all-encompassing, and that is what will improve the overall population health in Nigeria. As you very well know, Nigeria is going through multiple transitions all at once. It's undergoing a demographic transition with a population that is youthful, but at the same time it's aging. And the structure of our population is changing gradually. We're having an epidemiological transition, whereby the patterns of diseases that we have had for the last several decades are gradually giving way to some other new forms of diseases. Non-communicable diseases are more prominent, partly because we're aging, partly because of lifestyle changes. Those also need to be accounted for. Thirdly, we're also undergoing an economic transition from where we were a few decades ago to where we are now with services, with all kinds of new ways of doing things in the economy. And that have implication in terms of what people do. It's no longer just farming alone, but several other things. Mental health are emerging to be issues. So I think nutritionally, even what we eat is gradually changing from traditional what we eat, unfortunately, to more processed types of food. So we have higher incidence of diseases accompanying that. So to address that, it's not just one bucket. It's a whole of government approach, finance, planning, health, education, working in a coordinated manner to improve the health and well-being of individuals.
We'll attempt to break that down as we proceed, but this feeds into this next bit, where during the COVID period, one of the highlights for a lot of people was when the former SGF, Boss Mustafa, appeared before the NAS committee and said they didn't know the health sector was that bad. You know, and ever since then, many people have been looking to see, okay, what's going to change dramatically? How do we approach the health sector? And we see that visible change. But the rest is history. You're not new to the health sector. Tell us about this 4-point agenda of yours, which you spoke about. How are you going to operation? What are they first? Yes, you spoke a little bit about it. How is it going to be operationalized?
I think there's scope for significant improvement in terms of what we do in the health sector. At the core of it, people that work hard within the health sector have to be appreciated for what they have been able to do with limited financing, with all kinds of challenges. Take insecurity, for instance. There are many health workers who have been kidnapped in the course of doing their work in rural areas in different parts of the country. Yet, health workers have continued to work hard to deliver services. Now, are they perfect? No. Is there scope for significant improvement? Yes. And that's why we have articulated these 4 buckets of things that we would do. My colleague and I, the Minister of State for Health, Dr. Tunji Alausa, and I, myself, are committed, based on the President's mandate, to pursue those 4 elements to improve the overall state of health in Nigeria, one of which is to improve the governance of it. It's not just the federal government that has a responsibility for health of Nigerians. All state governors, all local government authorities have to play their part to invest, to ensure the services are delivered and the quality of services is good. We need to include everyone, not only the public sector, but the private sector in the conversation, the civil actors, to really speak, have a consensus as a country that we want to improve the health of Nigerians. We need to have better institutions that will regulate the performance of health, NAFDAC, others that are regulators in the sector, professional regulators. We need to have good data, and we need to be more transparent and accountable to Nigerians. And we need to speak to Nigerians with respect, and within ourselves reduce the discord. That is a realm of governance. We earn the respectability, but we forge ahead in one direction. The second part is to improve the population health outcomes, what we deliver. Primary health care, which is in the realm of states and local government, secondary facilities that are in the realm of states and local government, but the teaching hospitals and tertiary facilities under the federal government have to be run better. We have put our chief executives on notice. We want to know the quality of what is being delivered to Nigerians through the federal teaching hospitals. We will need to improve on the infrastructure, the equipment, and the capabilities that are inherent in those health workers in the front lines through the facilities that are controlled by the federal government. Considering the fiscal limitations of this country, I think we have to be realistic. But I think it's not out of place to think that quaternary hospitals need to be thought about. For 40, 50, since 60, 70 years, we've had 3 levels of hospitals. Since our population was 50, 60 million, first, second, and third. Is it not high time when we have 220 million Nigerians to think about the 4th level? Because when you look at other countries like China, they have 5-level health system. So I think thinking about quaternary level, specialized facilities is an important part of it. And bringing the private sector to contribute in doing that so that the medical tourism that goes abroad to private facilities can be returned at home. That's the second bucket. The third bucket is this healthcare value chain. There's a value chain inherent in health. There's a reason why health is the 2nd largest component of the US GDP. Why? Because from pre-service training to the services in running a hospital, not just the clinical services, to manufacturing of commodities, consumables, vaccines, medical devices, we have a lot of scope. At the moment, we are only buying from others. We don't produce as much as we should, or not at the quality or the number that. But if we do that well, we can export what we produce for health to the sub-region, to other regions in the continent, and also perhaps globally. So that brings in the economic value chain, that there is an economic growth imperative also in health. But that's not only the Ministry of Health. Ministry of Trade, Ministry of Finance, Sovereign Investment Fund, private sector actors, the regulators have to join hands, and we are driving that. That is a third pillar, so that we begin to be more producing what we need. And you mentioned COVID.
Yeah.
When COVID happened, we were asking for others to help us with masks, with vaccines, with all kinds of things. We should be in a trajectory whereby over the next several years, we have some modicum of production capacity that we don't need to ask for masks to be imported from far places. We have textiles. We can produce those kinds of things ourselves. That's what we're getting at. And the 4th bucket is really on this issue of health security. Health, COVID, which you said, started as an infectious disease, very simple infectious disease from Wuhan. It affected all parts of the world, but not all parts of the world, not all the population in the world had COVID infection. But economic impact of it has been devastating across the globe. Countries have now recovered. So it shows something, that health security is linked to economic security and is linked to national security. When Ebola happened, we saw what happened in West Africa. So investing in detecting outbreaks, knowing when they occur, responding to them, Some may be things like Lassa, like cholera, but others might be new pathogens that we don't even know. And when they occur, we should sense them, control our ports, and have the capability, the frontline health workers that are trained to address them before they get out of hand. And that we have the capabilities that are domestic in-house, but linked to other countries, because diseases do not respect borders. An infectious disease from China affected everybody. So we want to protect ourselves from what might come into our country, but we also want to be responsible parties in the global community by protecting diseases that are emanating from our own client, from going out of our borders to other countries. So it's an interrelated sort of interrelated issues that we have to deal with in this arena of health security, which is linked to our own national security, regional security, and global health security. And we'll pursue that through the Nigerian Center for Disease Control, through the many public health labs we have, the many researchers that we have. In both the industrialization as well as the health security aspect, there's an important role for research and development. We are not investing enough in the capabilities to generate new knowledge, new insight that is locally relevant in our own country, so that we can use that to generate intellectual property that can translate into producing things that will benefit our people and perhaps benefit the world.
Do you have a target to change that?
Well, we are laying down the foundations right now to improve the investments in research and development. In the short term, everybody knows the fiscal circumstances of our country. So I wouldn't tell you that we'll put X amounts of money towards research, but we'll mobilize even from external sources, from private sector sources, our own domestic private sector to contribute. Even institutions like the TED Fund, which has contributed immensely during the pandemic, financing, supporting research in our universities. We need to work with them to really invest more in generating new knowledge, the capabilities of our academicians, to really have insights that will translate into intellectual property that can be developed, which can be useful locally, but also useful outside our borders.
You know, Dr. Pate, well, you mentioned the universities, and that got me excited a little, because I do know that we have a lot of federal universities and even the private universities, all of them, or almost all of them, with medical schools, research institutions embedded in them. The question is, how strong would they, how quickly would that link, would that linkage between what you're planning to do, this 4-point agenda, and the relationship with these research institutions, a country, how quickly would that kick in?
Well, I mentioned that we have a whole of government approach to what we're trying to do. It's not just what is under our direct control at the Ministry of Health and Social Welfare. My colleague, Minister of Education and the Minister of State for Education, are two colleagues that we'll work closely with in terms of what TED Fund, for instance, can do for the health research institutions and our teaching hospital, because they are important part of building the capabilities. And that will be a start, but it's a long journey for us to go from where we are spending less than 0.5% of our resources of research and development to where we are spending significant chunk of our resources in research and development. The capabilities in our universities themselves have to be developed so that researchers ask the right questions, use the right methods, and produce results that can be touted really as world-class results. I know that there are some, like Christian Happy, which is here in, who is here in Nigeria, has done amazingly well, and he's recognized all over the world. And there are several others that are actually in that path, but there are many others that are much further behind. Working between health and education, I think we need to collaborate more, begin to lay the foundation so that the trajectory that we had been on, which has been, we are consumers of research from other places, would need to change over time.
Okay, in all of this, innovative ideas and things that you put out, there are challenges. One of the biggest challenges to the healthcare delivery in Nigeria is the fact that the population is not as informed as information. So would that be something that you'd be looking to turn around? How quickly, again, I like that quickly, because Nigerians will be looking to see what's the fastest way you can get these things done. To educate Nigerians about the health situation, how they can move away and become healthier people.
So in matters of health, no one can or should stand on the fence, because health affects everyone. It affects the media, It affects politicians, it affects technocrats, it affects parents, communities, and leaders of all kinds. You know, a few years ago when vaccination was an issue, we mobilized parts of the country that had resisted this by engaging trusted community leaders, traditional leaders, His Eminence the Sultan, religious leaders of all religions that we could engage with. And they mobilized the communities and expanded access to, expanded the acceptance of communities for those important life-saving services. We do intend to transform that effort to an effort whereby all traditional leaders, through their state councils of emirs and chiefs, are co-opted into this governmental effort, together with their state governments, to drive the awareness and the engagement of communities. And they have networks that go across to different levels. That's just one plank. The conversation we're having with you is not just to share information, but the media itself, what you say, can be far more influential than what the minister or any chief executive will say, because people respect you and you've got the platform to do that. So the media is an important element to translate what government is intending in a way that people begin to understand it better. And in terms of education, for instance, we talked about research side, which is of higher level, but I think it's important for our colleagues in the education sector, not only federal level, but state level, to begin to focus on the school health and also what we teach our young ones, so that they're aware, things like basic hygiene and sanitation and how it links to health, importance of scientific advances on vaccines, preventive things, early detection. Things like cervical cancer, for instance. It's an issue, it's a third leading cause of cancer in our country. Particularly, it's 100% women that have cervical cancer. And now there's a vaccine. And in the next few weeks, we will launch, under the leadership of the president, an effort to vaccinate, to prevent cervical cancer using the HPV vaccine. Now, people, parents, adolescents need to begin to understand that this is an intervention that will pay dividend down the pipe. And it's not just health people that will need to expand that. Overall, our country collectively has to have a consensus that this is what matters to us. Yeah. And the technical folks then deliver that. So
that comes under the health, you call it population health outcomes, right?
Yes, yes.
Again, that's one of the biggest parts, apart from the funding side, that your ministry will be looking to see how quickly these things can be resolved and move on. But again, that part about funding, when you've talked about bringing in the private sector, both locally and...
Yes.
Then there will be the issue of a lot of things looking for the limited resources that are available. Yes. What's the innovative way you're going to go about pulling in the funds that are needed, get the health sector in Nigeria up and going?
So I think it's very clear that for a very long time, Nigeria as a country, as a people, we had not prioritized investing in our health. And I'll explain why that has been the case. We spend very little public resources for health compared to many other countries. Much of the health spending in Nigeria is from families and out of pocket. Only $10, $11 per person is what our governments at federal level, at state level actually invest. That's low for the size of our economy. Overall, as you very well know, government collects less of its revenue compared to the GDP that it has. It's one of the lowest in the world. So yes, whole of government effort, and you were speaking about tax reform, that's why it's linked to more revenue for government. But within that revenue that needs to increase to government, it has to be prioritized so that more of it goes to invest in health. And that investment needs to go up. That will build our facilities, train our health workers, improve their conditions of service, provide the commodities, strengthen the regulators, so that as a people, and that's not only the federal government. Many state governments don't put a penny, a kobo, in terms of investing in their health for a very long time. They depend on external sources, and they use those sources through other ways. We need to build some efficiencies in other wasteful spendings and other sources of leakages so that the limited resources that we have can be put to good use. So there is a need to increase the resources overall to government, prioritize more of our resources in government to health, and that's the realm of the coordinating minister and the Minister of Budget, National Planning and Budget, and what we do in health in terms of providing those ideas so that the resources can be invested upon, and the governors also doing the same. And then the efficiencies, meaning that we cut losses, wastes that occur by investing in things that are really not needed, will not really serve the most people, but for various interests. And there we need our political leaders, the parliamentarians, our senators and House. Even if you have a constituency project, for goodness sake, put this constituency project in something that will be useful and translated into services for the people that you are trying to help.
All right.
The external side, the private sector has an important role that it can play. The economic value chain is there, so investors need to consider the manufacturers of generics, devices, the services, the contractors. They are also contributing, and that is the collective pool of resources that we need to put to use to improve the health sector, which will ultimately contribute in the productivity of our economy and its growth over the long term.
So we'll go to break, but when we return, there are a few scenarios that Nigerians face on a day-to-day basis when they try to engage with the health sector institutions there. So we'd like to ask you some of those questions before we go over to Lagos. But we're back in just a moment. Don't go away. All right, welcome back to Sunrise Daily. Prof, yes, we know the health sector is huge and it's a job of work that we all have to be involved in whichever way possible, because, I mean, we all know health is wealth. So about NAFDAC, what is it that you're going to do? Because it appears from the outside that they are overburdened. You know, there's usually a lot of focus on food, but there's drug components, so several scenarios. We know about some drug manufacturing companies, even those who deal here, who have stopped because of counterfeiting of some of those facilities, those meds. We don't even import a lot of what we need. I mean, that you also have stated severally. Are you going to what? Is there going to be some sort of reorganization, separating drugs and food? What would you do about that?
So we're going to be very deliberate in terms of the steps that we take. Commissioning institutional reviews of several of the parastatals in the Federal Ministry of Health. Look at their capabilities. What are they doing well and what are they not doing well? And how can we improve those capabilities so they are effective and efficient in fulfilling their functions? NAFDAC is a regulator of food and drugs. Over the last several years, I think the current Director General has achieved some key milestones. Globally, there is a maturity level that each national regulator gets to. Ours is maturity level 3. And there are only 3 other national regulators in Africa that have reached that level of maturity. We're working towards getting it to even the higher level, maturity level 4. And that is very objective, step-by-step way of improving the capability of a national regulator. But that is not to say that it's all good across the board. It may be good in terms of the licensing and in terms of maybe the food registration, but there are other elements that it may need to do more. Regulating the distribution of drugs, for instance, downstream. What happens in the ports is not only NAFDAC. Even if NAFDAC is there, the customs is important, NDLEA is important, and others are important to curtail the importation and smuggling of substandard products. But then when they are distributed as well, NAFDAC has to be able to work with others to ensure that the regulators, NDLEA, Pharmaceutical Council, and NAFDAC work to stem those illicit or substandard drugs from being distributed. You hear a few of them being announced in the public space, but there's a lot more that is not either detected or it's not coming out in the public space. So NAFDAC will need to do better in that, and it has to be a stronger institution that has trained people and that is researched accordingly. Things like bioequivalence, in terms of the laboratory to test not only the chemical equivalence of drugs that are coming into the country or manufactured in the country, or whether they are biologically equivalent to what they purport to be. Those are things that we would do in 2024, for instance, to ensure that Nigeria has a bioequivalence lab that is able to satisfy others. Now, our manufacturers will be shafted if we don't have an effective regulator. So as part of this industrialization, you need a strong regulator which then allows folks to compete on the basis of quality. Because if you produce at a higher price and yet the market is being flooded by substandard products at cheaper price, you will not survive, like you said. So that's just an example of how proper regulation, not predatory regulation, but really effective, efficient regulation can play in catalyzing not only domestic production, but also protecting the health and well-being of Nigerians. I think that's an important element of the overall governance of the Nigerian health sector, which we had not attended to in a very concerted way compared to what we are now planning to do.
Insurance. We know how huge health insurance is, not just here, but globally. How it helps, takes away a lot of burden and so many things. I've been to a lot of some of these facilities, and I see how important the potential it has, but there's a huge limit. People can't exceed certain thresholds. So are you going to focus on that in that area? What would you do about it?
Well, this is one of the promises that President made during his campaign, which was buttressed by the Presidential Advisory Council, to expand, to make the National Health Insurance Authority, the new authority which was signed into law by his predecessor, to double down on expanding insurance coverage on Nigeria's path to quality access, universal health coverage in particular. That's sort of on the path. We need that. Many Nigerians are pushed into poverty by cost of ill health. Financial protection issue is not going in the right direction because there are many families, many households, the cost of paying out of pocket actually impoverishes them. You and I may afford certain things, but imagine a farmer, a trader in a local village who gets malaria and he has to cough off 5,000–10,000 naira to buy medicines. That is a large chunk of the household income. That means they forego food on the table or paying school fees to pay for ill health. They go into poverty. So health insurance is a very important part. But over the last 50 years, Nigeria has been on a journey since 1974, and we are still not up to 10% coverage. Why? Because there has to be a large enough risk pool, and folks have to contribute into that pool so that those who are ill can be protected. We never really did that until recently. It was voluntary, and even the formal workers were not contributing. But with the new Health Insurance Act, which has made it mandatory, states need to come in, employers need to come in, and individuals, private individuals need to contribute so that we have a wide enough pool that allows us to pay for those who are ill. It's an insurance, but it's a national insurance that we should have. Even there are different parts within the insurance.
Okay.
Now, the effectiveness of the regulator has to be looked at, and that's part of the review that we're going to do. NHI as an institution, and how we interface it with health maintenance organizations. Are they busy chasing their businesses, or how do they ensure that in fact there is quality of what is being purchased, that the standards are high enough, and that there is commensurate, let's say, sets of accountabilities in terms of the care that is being delivered. So all in all, we need to expand it, no doubt. We have not done it. If after 50 years we are at 10%, if I tell you that we'll go to 80% in 4 years, I'm not being truthful to you. So, but it's a Herculean task, but it can be done. And we are really going to focus on the National Health Insurance Authority to ensure that, in fact, it is more effective, more efficient in regulating this sector, consistent with the aspiration for universal health coverage.
Dr. Pate, I know my colleague...
Health workers. Just a quick one. This is a two-pronged one before we go to Lagos. You did say that 400,000 personnel in the workforce is not enough.
Yes.
But we know that health doctors in this country don't feel valued. So time and again, they're on their way, on their bike out of the country. So what specifically, because you can't achieve much if you don't have those key personnel here, how do you intend to ensure that they don't ever go on strike, and perhaps the rivalry between themselves and other health workers is addressed?
I was just going to put in that the nurses and all of that, the auxiliary workers, the midwives are also feeling, hey, what are we doing here, and all of that. So.
Well, health workers are the most important ingredient that we have to produce health. They're so important that without health workers, we cannot have good health services. Robots cannot deliver. Hospitals cannot deliver, and equipments cannot test themselves. And when I say health workers, I mean the doctors who are highly qualified, and there are many great ones in all of our hospitals in Nigeria. There are exceptionally talented nurses that we have, brilliant pharmacists, we have laboratory scientists, we have community health workers, we have different cadres of health workers in Nigeria. And I believe there is no health worker that goes into health profession who does not want to serve others to help make someone's life better. But the circumstances around them, the clinical governance systems around them, compensation, and other issues that have emerged over several years have undermined their ability to deliver, and many of them leave and they get into these rancorous fights because it's become extraordinarily political. I would say, in the last 3 weeks, a colleague, the Minister of State, and I have engaged with several of them. Jesu with MD Khan and with the Nurses Midwives Association. And all of them accept that we're all on one side. We're on the side of the Nigerian people. And that we're arguing for the same thing. We need to improve the health of the Nigerian population. And that we need to put some of these issues that are legacy issues, lack of trust that has emerged from both sides not behaving necessarily all the time in a good direction. And that message has resonated. Just yesterday, the Medical and Dental Consultants of the Association of Nigeria, MD Khan, announced they are suspending their planned strike because we engaged and had a conversation with them. I saw that in the media, and I think it's very commendable. We saw the nurses and midwives who were contemplating going on some industrial action, and they told us that they will not do that again. Now, Jesu, I think, is a very constructive partner. So with that approach, we would go deeper to understand the basis for these conflicts that have been incessant over the last 10 years. Since the commerce and coinheads, all kinds of issues have emerged, all kinds of strikes, counter-strikes. At the end of the day, people want to be respected, want to be treated with dignity, want to be enabled to perform their function as health workers. Now, it's not an easy mess to sort out, I would say. But we are committed, and I know that we have the President's backing, to do our best and agree on those things that are feasible, practical, doable. And for those that we disagree, once the other sides understand that, look, these are issues that are legacy, and we begin to put them aside and actually focus on providing health for Nigerians, I think we will all be better for it. My expectation is that we'll see less and less of that, as we have seen with the MD card, an excellent example of the spirit that we want to bring. Say, let's focus on the Nigerian people and their health and well-being. Our other issues, yes, there's a lot of suffering, but the suffering goes beyond doctors. Teachers are suffering. Even media is suffering. But all those are transitory suffering because the president has a bold vision for transforming the economy. We'll get out of it. Until we do that, let's ensure that we do what is important. While the squabbling has been going on, health outcomes have not improved. People travel to India and other places for medical tourism, and yet we're fighting ourselves. Does it make sense? So with that approach that we're coming to the table with, respect each other. Wherever you are, a health worker, you are valued. To begin to address some of those outstanding issues in a responsible manner. We've promised to earn their trust, and they have also promised to earn our trust. So the government and the health workers are all on the side of the Nigerian people. For sure, the president is on the side of the Nigerian people. He wants to do whatever it is. And so if we take that approach, I think we should see less and less. And even if they are on the fringes, folks that have other agendas, I think the Nigerian people will see through. There's no need for that if you're a health worker. By doing so, we'll earn the respect of Nigerians and the profession, whether you are a nurse, whether you're a pharmacist, whether you're a doctor, no matter how brilliant you are, at the end of the day, you only achieve that fulfillment if you can treat patients, you can help others get to a better health.
Ayo.
You guys, well, Prof, when Chamberlain asked you about insurance, the first word that came to my mind is that many people would rather go for phytomedicine. And it also helps me recall what the DG of NAFDAC said in response to Chamberlain's question in 2020, when we asked then, when at the initial outbreak of COVID-19, that the whole idea was, look, the low-hanging fruit for most Nigerians was phytomedicine, herbal medicine. And we've also been told and seen, reports of even the World Health Organization very much interested in traditional medicine and all of that. Is there a plan to match data or research with the realities of what people generally go for, which is to go for herbal medicine when they cannot reach the orthodox medicine within their budgets?
Yes, thank you for that question. I think there is evidence that many Nigerians go to several providers before they get to the formal healthcare system when they are sick. They go to religious bodies, they go to traditional doctors, they go to herbal doctors to actually get the care. And when they all fail, then they show up in the formal healthcare system. So part of it is we need to enhance the confidence of Nigerians that the services will be there, they'll be treated with respect, and they will have the care that they need within the affordability limits that they have. So that's one part. But the phytomedicine in particular, I think there is a potential in there. And the Director General of the Nigerian Institute for Pharmaceutical Research and Development, NIPRID, Dr. Obinna Adigwe, has done an excellent job in terms of building the basis for us to understand better the resources that we have in the herbal medicine arena. But we need to study them, we need to categorize them, we need to build that body of knowledge so that phytomedicine, when they come to people, they are safe. NAFDAC is working to understand how best to regulate that so that they are not causing harm. Because there may be some phytomedicine products that may cause harm if not applied in the right patients. Take, for instance, somebody who has liver disease, and they take a medicine that can compound their liver condition and tip them into liver failure. So that's the balance that we need to create over time. So it's not either or, but we have to be responsible in protecting, safeguarding the products that our people consume. And that sector itself has to be better regulated so that we don't have charlatans that can prey on the poorest amongst us, promising them remedies that may not necessarily be true or be proven or be safe for them. And that is something that we are going to work on, so that over time, the Western medicine, which is the more formal medicine, because that's a product of colonial experience that we have, is also not at the expense entirely of our domestic indigenous knowledge. There's some value in there. We don't throw that out just because we are going for Western medicine. But we have to do it in a responsible manner, and we have to use sort of good scientific methods to understand what is better, what is not. In Western medicine, there is a process of clinical trials to compare whether something works or it doesn't work, study it to be sure there are no side effects, and whether the placebo effect is not what we are seeing before it is adopted. Now, we need to subject some of this within the system of knowledge that we have, the traditional knowledge system, and see what is it that at least is not doing harm. Because first, we should not do harm.
Well, Prof, you know, it's a long conversation you just started right there, because the people in the villages and in the interior communities are wondering what you're talking about, especially when their realities are right there in their faces. And talking about communities, it brings to mind the issue of primary health centers. I know that my colleagues stated it earlier, but back in 2019, the federal government said it was battling with $10 billion annual infrastructure deficit in the health sector, which at the time amounted to 3.06 trillion naira over quite some time. So it just raises the question of generally, infrastructure generally, but particularly primary health centers. When are we likely to see these PHCs become functional so that Nigerians can stop unnecessarily traveling to tertiary health centers for mere, simple issues such as malaria? Well, even though it's a killer disease, which many people don't even know it is. When is that going to happen? Is there a timeline for that, sir?
So for 20 years, our national health policy has put primary health care as the foundation for our health system. We have 34,000 primary health care centers in this country. All of them are in the purview of states and local governments, and the federal government supports them through the National Primary Health Care Development Agency. And in the last few years, many have been revived to be functional, but less than a quarter of them are truly functional. So there's a scope to expand the infrastructure, the equipment, but importantly, the human resources, the community health workers, the nurses and midwives that are out there, and the medical officers that need to support them, and the referral system. That requires financing. And therefore, in 2024, we're going to work with our legislatures at the federal level, but also hopefully with our state governors and their own state legislatures to appropriate resources to invest in the infrastructure as well in a responsible manner. So the primary healthcare centers are built up, but also where they are existing to be refurbished and to be equipped and have the right health workers. In many local government arenas, which you probably know, they are health workers, but they're not really trained health workers because politicians at the lower level sort of appropriate slots and put in for employment people who may not be trained. Well, that's what we have, and they may need to be retrained. But that requires investments by the states as well. Wherever you see a primary healthcare system being functional, the leadership is at the state government. The State Primary Healthcare Development Agency, the state governor. We would like to see state governors paying attention to the most basic services for their citizens, whether it's immunization, preventing things like diphtheria or measles, or even the type 2 polio that is emerging in some states like Zamfara and Sokoto states, for instance. That the governors pay attention to that, and the federal government supports them, because all the three tiers of government have to work together for the primary healthcare system to be revamped to the level that Nigerians will enjoy it. That hasn't happened as well in the last couple of years. We do hope, and Mr. President is very committed to this direction, that we will work with the state governments, we'll work with the local governments, and through the MPHCD and the Federal Ministry of Health, really focus Nigerians on ensuring that as much as possible, we improve the state of our primary healthcare system so that our citizens get the care that they deserve.
All right, Prof, we have several questions from the viewers, but we can only try to take one or half because we were completely out of time on this one. And it's about accident victims dying, because this has defied several governments and directives. What are you going to do to change it? Hospitals accepting accident victims because they claim no reports, no police report, they can't accept them.
Yeah, we will look at that. I think before we came in, there was a National Emergency Medical Services agency that was created, and that was to be financed out of the Basic Healthcare Provision Fund, which was put together through the National Health Act. And we would look at that because we need to have an emergency medical system that is national, but it cannot just be held by the Federal Ministry of Health. It requires many of these hospitals, the 34,000 facilities that we have, only about, I would say about 100 or so in the realm of the federal government direct control. Many of them are in the realm of the state governments and the local governments at primary healthcare centers. So it's a national approach that is needed. And we would be reviewing that as part of our effort to improve health outcomes. So Nigerians suffer from communicable diseases, non-communicable diseases, but injuries are also an important part of it. That's on the care side. But on the prevention side, when I mentioned whole of government approach, what the Ministry of Transportation does, building roads, road safety, blood transfusion, those are all elements that are also needed. Perhaps improving the circumstances of our roads alone could prevent many of those accidents from happening. Enforcing by the Federal Road Safety the quality of the drivers, their vision, their use of substances, the speed limits, can reduce many of those injuries so that the few that occur can be attended to. So it's not something that is entirely within the domain of health treatment, yes, on the health institutions, but there is a whole realm of other issues that needed to be addressed as well to prevent this from happening. Drivers themselves being responsible not to drive with tires that are really run down or vehicles that have no brakes. Those kinds of things are important to prevent the accidents from happening. But when they happen, we should have in place the policies like treatment of emergency accident victims. Yeah. We would look at that, and there is some funding, but it's not going to be enough by itself.
Okay. All right. We have to go. We do thank you for coming on, Professor Muhammad Ali Pate, Coordinating Minister of Health and Social Welfare. Thank you for coming on, and all the best to you and your team.
Thank you very much for having me. Thank you.